Red flags in your residency application, you're not alone. Whether it's low step scores, gaps in your medical education, we're gonna cover it all, and I'm gonna tell you exactly how to overcome them. My name is Dr. Slayman, I'm a general surgery resident. Let's get through these flags. Red flag number 1, gaps in your training. So whether you're doing a clinical year overseas or getting some research done or even setting the steps in the meantime, whatever you may be doing, you need to explain this. And before your interviews, and trust me on this, they will ask you that in your interviews. What have you done? How does this help? And how can we ensure that you're good clinically? Most program directors want someone that they can trust to look after their patients in the hospital. But before then, so that you don't get flagged and your application doesn't get discarded, you want to talk about this in your personal statement. If you are clinically active, or even if you are pursuing research, make sure one of your letters actually talks about that. Red flag number 2, low or failed USMLE scores. So back in the day when we had step 1, if you perform better on your step 2, that massive growth shows people that you've been working hard, that you've been growing. Red flag number 3, you didn't match, and it happens to many people, and you're applying again. So some programs have filters that actually filter through applications. How to bypass that is by knowing where you're applying to, knowing these programs, and getting people that know you to contact them. This way, they specifically look for your application, even if you've been filtered out. The next thing you want to do is you don't want to apply the same. You want to upgrade your letters, you want to upgrade your research, you want to upgrade your personal statement. You want everything to look heaps more elevated. You want to learn from the prior year and address it in the current match. Red flag number 4, weak letters or no clinical experience. Sometimes if you're moving from overseas, you may not have had that experience in the US. You don't want a generic letter that says you're just nice. Everyone can be nice, and people know that they don't know you very well. So set your expectations. So if you're a medical student, you want to plan for them ahead of time. You want to go in there, you want to do some rotations to prove that you have what it takes, that you understand, that you're trying to learn this new system and adapt to it. And for those of you who are American students, you want to showcase that you have come from a different system, but you're willing to adapt, you're willing to go above and beyond for this new place. You want to also set your expectations from the get-go. So say a week passes, you sort of check the vibes out, you've spoken to residents about it, you want to get a strong letter of recommendation. You want to showcase yourself, you want to make sure that you're in front of the attending as much as possible so that they can write nice things about you. And so that it's tailored towards you, so it doesn't look like this is just a copied and pasted a letter that they've used for various different applicants. Don't be afraid to do a preliminary year. Sometimes you got to do that. This gives you 12 months of new experiences. Before your application comes through, you'll go through about 4 rotations, and then during the interview season, you'll have a couple more. And if you're applying to that institution, it's even better. But don't be ashamed of that. This helps you form stronger connections because you're actually there for heaps longer than just a month or 4 weeks. If you're an IMG, you may be limited to some programs that offer you a visa, either J1 or H1B. All you have to do is to ensure that you've looked it up ahead of time. You want to save money too. So you go on FREIDA and you look for the programs that accept H1B or J1 visas. I'm not saying programs can't make exceptions, it just makes life heaps easier. There's no shame in that. If you have the time and you want to go above and beyond, look at programs specifically. How many of them have taken international grads? The stalking game is real. You can go into different websites, you can look up residents in different programs and see where they've graduated from. Your chance of matching and their acceptance of international grads is based off of that. Red flag number 6 is professionalism issues. So for this matter, you want to be up front and center. You want to own up to it. You want to mention it smack bang in the center in your personal statement. And most importantly, you want to show them how you've grown from this matter, how you're never going to do that again, or what you've learned from that situation. In this entire process, the main thing is to show that you've grown, that you can take this and take it the next step further. And having said that, even in the hospital, professionalism issues occur. Sometimes you have a tiff with a nurse. Sometimes you have a tiff with a colleague. You are at a much better situation if you can show that you're resilient and you can deal with different adversities. Okay, let's do a quick recap. Some of the red flags: gaps in your medical education, low step scores, weak letters of recommendation or no clinical experience, applying for the match again, needing a visa, and professionalism issues. Hopefully with this video, you can conquer it all. So let me tell you about some bonus tips that works in any situation. Just last week, I met a urology intern. It's quite a competitive field. So this is something that blew my mind away, and I find it's quite fascinating because I don't know how many people would go and do this thing. So she messaged every single program director from all the programs that she was interested in applying to. She messaged about 30 programs. She got 4 responses back. And she just asked them, how do I get into urology? What makes me competitive? This is my situation. This is where I'm graduating from. Those places gave her a position to do a clinical elective, and those 4 places were also the only 4 places where she interviewed at. This shows you that networking is the main thing. If you're still worried, you want to do research. There's no shame in a research year. You can find them on X or on Med Twitter. And you can find them most often around that May, June, July period where people have matched and they're announcing it, and now they're ready to take over their new roles and they're letting go of their old research position. Number 2, as I mentioned, network. Network with residents, network with faculty, network when you present things at research meetings. There's no limit to how much you can network. Number 3, prioritize hands-on clinical experiences. If you have no choice, do an observership. It's better doing something than nothing. But if you can get clinical electives, definitely go ham. And then finally, don't be ashamed, have a backup. Do a prelim year, do a research year, go elsewhere, and make sure you get people that you have worked with to call in for you. They have networks. They know people in different fields. They've graduated with people who now work in different departments. Ask them to call for you. If you're close with someone, they most likely will. Don't be ashamed of asking them to go above and beyond for you. You're a good applicant, you're worth it. If this video is helpful, or if you have any more questions, feel free to leave a message in the comments below. Hit like, hit share, get in touch with me on the gram, and I'll catch you next time.